Oh man, this one's going to ruffle some feathers, but let's do it because we're talking about statins. Statins are handed out like candy, but at what cost? So let's talk about what you're not being told about statins, especially the side effects that could be impacting your brain and your body. Okay, I'm Dr. Adam, I'm a natural healing expert, and I'm going to give you the other side of a statin story. Okay, so what are statins supposed to do? Statins block an enzyme in your liver that lowers cholesterol, especially the LDL cholesterol. And these are prescribed to reduce the risk of heart attacks and strokes. Okay, but they treat a symptom, high cholesterol, not the actual cause, which is inflammation in the body, blood sugar problems, stress, etc. This is evidenced by the fact that there is a statistic in medicine called number needed to treat. The number needed to treat for a statin medication for it to have benefit for one person is 67, meaning that 67 people need to take a statin in order for one person to have the benefit. That's one of the clues that lets us know there's something else going on here that's causing it. Okay, like inflammation, blood sugar issues, etc. And so now this is more of what the functional medicine viewpoint on this issue is. And to talk about cholesterol more from this functional medicine viewpoint, it's that cholesterol is often elevated because your body is trying to actually repair the damage that's done in your blood vessels. Okay, it's not just because you ate bacon. Okay, so inflammation and insulin resistance and oxidative stress, these are often the real culprits of damage in your vascular system. And if you don't fix those, a statin is not going to be solving the actual problem. Okay, so side effects. Statins do come with a few side effects, which we hear all the time from our practice members who come in looking to optimize their health and really regain control and possibly decrease the need for medications, which is very possible. We see it all the time. But one of the complaints that we really often hear about is muscle pain, muscle weakness as well. This is the most common side effect. And a lot of women and men think that they're just getting older. They just kind of accept the way that they feel due to age, but that is not the whole story here, okay? So, it could just be the statin. Maybe not in every case, but oftentimes enough, the statin's causing that. Okay, another common issue that statins come with is brain fog and memory problems. Okay, because cholesterol is crucial for your brain to function. It's part of what builds the cells that your brain is made from. Okay, and lowering that too much will then impair your cognition and impair your brain's function. Okay, one of the last side effects that's not uncommon either is fatigue and swings in energy. Low energy, because statins lower CoQ10. It's probably one of the mechanisms. CoQ10 is a nutrient that your body uses, your cells use to produce energy. And so when you're taking statins, it actually depletes the levels of CoQ10 in your body, which is why it's wise to take a CoQ10 supplement when you're using a statin. Okay, so I might as well mention this too while we're talking about it, is that there's also some evidence for an increased risk of type 2 diabetes. And so this is especially in women and people who already have some kind of metabolic dysfunction and are metabolically unhealthy. Okay, so yeah, statins are big business for the pharmaceutical industry and there's a lot of money involved, so they have a lot of incentive to push these things. But there are some people who might actually benefit, okay, to be fair, which are people who have already had a heart attack or a stroke, okay, to prevent this from happening again. And then people that have familial hypercholesterolemia. So it's a rare genetic condition that keeps your cholesterol levels elevated. Okay, but for most people, most women and men with slightly elevated cholesterol and no major risk factors, a statin might be doing you more harm than good. And thankfully, there's a natural medicine approach. Okay, so what we do in functional medicine, natural medicine, is to test markers like CRP, which is a great overall marker of inflammation. We're looking at other metabolic health markers like insulin, or your triglyceride to HDL ratio. Okay, these are markers that most conventional doctors don't look at. But the science in functional medicine in the last 5-10 years is coming out and showing this is what we need to be looking at if you want to get a real picture of your cardiovascular risk. Okay, then for treating this and helping your body to heal itself and optimize your health and decrease cardiovascular risk, you support your body naturally. Okay, doing things like increasing the fiber in your diet and protein at every meal. Okay, omega-3 fats, whether that's in foods like fish, salmon, wild caught, or in a supplement form, taking at least 1 gram of EPA plus DHA, those are the active ingredients in the omega-3s every day. Exercise is key for this. Consistent exercise, 30 minutes a day, 5 days a week. And then resistance training. You want to do strength training in addition to that. That's going to help manage your, optimize your body's metabolism and blood vessel health and everything, really. Okay, and then supplementally, make sure you're getting CoQ10 if you are continuing to take a statin to replete that nutrient which the statin is depleting from your body. Magnesium will help too, antioxidant-rich foods. Okay, so it's not just about lowering cholesterol, it's about lowering inflammation overall. Okay, so if you've been told that statins are your only option, then that's simply not true. Okay, you deserve to understand that your real risk, and it really depends on handling your diet properly, handling stress. There's environmental toxins that create inflammation in your body. There's a whole plethora of reasons that your body produces inflammation that can eventually lead to cardiovascular risk. So it's important to get really good, solid handle on what those are. And so to do that, I invite you to take our quiz, our overall health assessment quiz, to see where you are at now. So you can find the link in the description below. And that quiz will ask you some questions, give you a broad sense of overall where is your health at, and give you a number, kind of a score numerically to see where you measure up versus optimal health. Okay, so I invite you to take that quiz, see where you are right now in the scale of poor health to optimal health, and like and subscribe to the video if this was helpful for you. Send it to someone who needs to hear this if they're taking a statin and they're not happy with it or they're having these side effects, and to show them that there is a natural way to resolve this. Okay, and we'll catch you in the next video.